Hello. Uh, Let us now study about the ribs and its classification. So, this is a thoracic cage which is formed in front by this bone. This one is the sternum, and behind by this vertebrae, and on the sides by the bony arches, that is the ribs. So, ribs forms a major share in the formation of the thoracic cage. So, these ribs increase in its size from first to seventh, 1, 2, 3, 4, 5, 6, 7th, and then gradually it decreases in its size. There are 12 pairs of ribs, of which the seventh rib is the largest or longest rib, and the eighth rib is the most laterally projected rib, and the most obliquely placed rib is also seventh rib. I repeat, the seventh rib is the longest, it is most obliquely placed, and the size of the ribs increases from 1 to 7, and then gradually it decreases. These ribs, it begins from behind and it is obliquely placed. Posterior end is at a higher level and the anterior end is at the lower level. Now, if you go with the classification of the ribs, there are many ways of classifying the ribs, and the first one is according to similarities and dissimilarities. The ribs can be said as a typical rib or atypical rib. Out of the 12 ribs, 7 ribs are having same features. That means we cannot differentiate. When individually one rib is given to you, we cannot say whether it is 3rd, 4th, 5th, 6th, 7th, 8th, 9th. So, 3rd to 9th rib are having same features, hence they are called as typical ribs. So, typical ribs are 3 to 9. Atypical ribs are 1, 2, 10, 11, 12. So, they are having some features which are different from that of a typical rib. So, this is the usual question which is asked in the examination: which are typical ribs, which are atypical ribs. So, 3 to 9 is typical, the other ribs are atypical. Second way of classifying is according to the relations of ribs with sternum. So, if you see the rib, posteriorly from the vertebra, it articulates with the vertebra and ends in the sternum. So, there are certain ribs which begins from the vertebra and ends directly into the sternum. So, that means till 7, 1, 2, 3, 4, 5, 6, 7. So, till 7 they are directly articulating with the sternum through its costal cartilages. So, the upper 7 ribs are said as true ribs. True ribs are 1 to 7, and the remaining are false ribs because they directly won't articulate with the sternum. Either through the costal margin they articulate, or the last 2 ribs doesn't articulate at all. So, 1 to 7 are true ribs, 8 to 12 is false ribs. Third classification is according to articulation of ribs. There are 3 types: vertebro-sternal, that means posteriorly it begins from the vertebra and anteriorly ending in the sternum. So, 1, 2, 3, 4, 5, 6, 7, upper 7 are vertebro-sternal. Second one is vertebrochondral, that means this one 8th rib, 9th rib and 10th rib doesn't articulate directly with the sternum, instead they articulate with each other to form a costal margin like this on either sides, and through that it ends in the sternum, hence they are called as vertebrochondral ribs. And the last one is vertebral ribs, that means posteriorly it begins from the vertebra and anteriorly it is not articulating with the sternum at all. So, these are ending abruptly in the midway, hence they are called even as floating ribs. So, these are called as floating ribs or vertebral ribs. They begin from the vertebra and does not end in the sternum. And the fourth classification is according to state of anterior end. Floating ribs, non-floating ribs. So, the anterior end is pointed and doesn't articulate with any other structure is floating ribs, that means 11 and 12, and the remaining 1 to 10 are non-floating ribs. So, this is all about classification of the ribs. Thank you.